Have you ever experienced testicular pain? If so, you may have been concerned about whether it was caused by something serious. However, the good news is that testicular pain is usually not a symptom of anything dangerous. There are many potential causes of this uncomfortable sensation, ranging from minor injuries to infections. In this video, we'll talk about various reasons why your testicles might hurt. We'll also explain when you should seek medical attention. Orchitis, a condition in which one or both testicles become inflamed, is a common cause of scrotal pain. Orchitis can be caused by a viral infection such as mumps, but it's more frequently caused by a bacterial infection that spreads from the prostate, urethra, or bladder. Some sexually transmitted infections, including chlamydia and gonorrhea, can also result in orchitis. Symptoms of orchitis include fever, nausea, vomiting, a burning sensation when urinating, and pain or swelling in the testicles. If left untreated, this condition can lead to complications such as abscesses, swelling of the epididymis, or infertility. Epididymitis is another possible cause of testicular pain. Epididymitis is inflammation of the epididymis, a long, thin tube located on the backside of each testicle. As previously mentioned, this tube stores and transports sperm. As in orchitis, bacterial infection is a common cause of epididymitis. However, it can also be caused by a viral infection or injury to the testicles. Sexually transmitted infections such as chlamydia and gonorrhea are among the most frequent bacterial causes of epididymitis. This condition can cause symptoms like pain and swelling in the testicles and severe pain when bending or stretching the testicles. Those suffering from epididymitis may also experience fever, chills, pain during ejaculation, or an inability to ejaculate. If left untreated, epididymitis can lead to complications such as an abscessed epididymis, infertility, or the spread of infection to the bloodstream or other parts of the body. Another medical condition that can cause testicular pain is varicocele, which is a type of varicose vein. This condition occurs when veins that drain blood from the testicles become enlarged and twisted. Varicocele are generally harmless and don't always cause pain. However, they can cause discomfort or a dull ache in the testicles or scrotum. In addition, men who have varicocele may notice a feeling of heaviness or a dragging sensation in the scrotum. In addition to these three conditions, there are many other potential causes of testicular pain. Injuries to the testicles or scrotum can cause acute pain that resolves on its own or with home treatment. Testicular torsion is a rare but serious condition that occurs when the spermatic cord that supplies blood to the testicle twists. This can cut off blood supply to the testicle and cause severe pain and swelling. Testicular torsion is a surgical emergency and requires immediate treatment. Hydroceles are another possible cause of testicular pain. A hydrocele is a fluid-filled sac that develops around the testicle. While they're usually harmless, hydroceles can cause discomfort or a feeling of heaviness in the scrotum. Inguinal hernias are also a cause of testicular pain, which occur when part of the intestine pushes through a weak spot in the abdominal wall. This can cause a bulge in the groin area and severe pain when lifting heavy objects. And finally, cancer is a rare but serious cause of testicular pain. Testicular cancer is most common in men between the ages of 15 and 45 years old. Now that we've covered some of the most common causes of testicular pain, let's discuss how these conditions are diagnosed and treated. A thorough physical exam is the first step in diagnosing the cause of testicular pain. Your doctor will ask you about your symptoms and medical history, as well as perform a rectal exam to feel the size, shape, and consistency of your testicles and prostate. In addition, they may order blood tests to check for signs of infection or other conditions such as prostate problems or liver disease. Imaging studies like ultrasounds or MRIs can also help identify abnormalities in the testicles or surrounding structures. After diagnosing the underlying cause of your pain, your doctor will develop a treatment plan tailored to your individual needs. Some conditions like viral infections may resolve on their own with bed rest and over-the-counter pain relievers. Antibiotics are commonly used to treat bacterial infections such as epididymitis or orchitis. In some cases, antibiotics need to be administered intravenously, while in others you may be able to take them orally. Pain medications such as ibuprofen or acetaminophen can help alleviate discomfort associated with testicular pain. However, it's important to follow your doctor's instructions and never exceed the recommended dosage. In addition, your doctor may recommend applying ice packs or wearing supportive underwear to reduce swelling and discomfort. If necessary, your doctor may also suggest wearing a scrotal support or athletic supporter to help relieve pain and swelling. This is especially useful for injuries or conditions like epididymitis or varicocele. Finally, in some cases, surgery may be necessary to treat the underlying condition causing your testicular pain. This is particularly true for conditions like testicular torsion, hydroceles, or varicocele that cause pain or fertility issues. During surgery, your doctor will make an incision in your groin area to remove or repair the affected testicle, vein, or other structure. Now that you're aware of the various causes of testicular pain, it's important to prioritize your testicular health. Make sure to schedule regular appointments with your urologist, who specializes in the male reproductive system, to discuss any concerns you may have. These appointments will allow you to receive preventative care, identify any potential issues early on, and ask any questions you might have regarding your sexual or reproductive health. During these visits, your urologist will examine your testicles to ensure they're refunctioning properly and answer any questions or concerns you may have. They'll also advise you on the importance of self-exams and demonstrate proper techniques so you can check your own testicles at home. By learning how to perform self-exams, you can help detect any potential issues early, potentially improving treatment outcomes. In addition to regular checkups and self-exams, it's essential to take steps to protect your overall health. Maintain a balanced diet, exercise regularly, and avoid smoking and excessive alcohol consumption. Living a healthy lifestyle not only reduces your risk of developing testicular pain or other diseases, but also helps keep your immune system strong, which is vital for fighting off infections that could cause testicular inflammation. Finally, make sure to stay up to date on vaccinations, particularly those for preventable viral infections such as the mumps. The mumps vaccine is included in the MMR shot, which protects against measles, mumps, and rubella. Staying informed about your health and taking proactive steps to care for yourself can help ensure your testicular health and overall well-being. Remember to prioritize your health, schedule regular checkups, and make lifestyle changes that will benefit you in the long run. By being proactive, you can catch any potential issues early, minimize the risk of testicular pain or other diseases, and maintain your overall quality of life. If you enjoyed this video, please share it with your friends and family. We hope that sharing this information will help raise awareness and encourage others to prioritize their own testicular health. Thank you for watching.